You know that moment of pure panic, a bad fall, an elbow to the mouth during a game, and you realize a piece of your tooth is just gone? But when that break is really deep, when it exposes the living nerve inside, that's a whole other level. It's a true dental emergency. Today, we're going to break down these complicated crown fractures and look at the brand new roadmap the dentists are using to save these teeth. Let's get into it. So, when you're faced a broken tooth, the path to saving it isn't just one straight line. It's really more like a map full of different routes, depending on the exact situation. And this flowchart, this is our guide for today's entire explanation. It is based on new international recommendations, and it's the decision tree that helps a dentist navigate the chaos of an emergency and pick the absolute best way forward. So, what's the big deal? What makes a crown fracture complicated? Well, it's actually pretty simple. The break is so deep that it exposes the dental pulp. That's the living, breathing core of your tooth, packed with nerves and vessels. And once that core is open to all the bacteria in your mouth, the number one goal right then and there is to protect that exposed pulp from getting infected. If infection sets in, the pulp can die, and that could mean you're looking at a much more serious root canal or even losing the tooth altogether. So, yeah, quick correct action is super important. Okay, so before a single tool is picked up, the clinician has to turn into a detective. Because that chip you see on the surface, that's almost never the full picture. A real investigation has to happen to find any damage that might be hiding in plain sight. And this right here, this is the number one thing they're looking for: a concomitant luxation injury. I know it's a mouthful, but you can just think of it as a hidden sprain to the tooth support system. See, the same force that broke the crown could have also knocked the caused injury to the tooth's surrounding areas. And that's the tooth's lifeline. Okay, so why all the fuss about the hidden sprain? Why is it so critical to find? Well, it turns out that discovering this one piece of information can dramatically, and I mean dramatically, change the tooth's chances of survival. Okay, get ready for this number. Approximately 30%. Just let that sink in for a second. That number represents a massive, massive jump in the risk of the treatment failing. So here's what that number actually means. According to the research behind these new guidelines, if a tooth only has that crown fracture, the risk of the pulp dying is super low. But if you have that same fracture plus a hidden luxation injury, that risk skyrockets to over 30%. Damaging the blood supply is a total game changer. And this chart just lays it all out crystal clear. Look at this. One study showed a fractured tooth without that sprain has 99% chance of pulp surviving. I mean, that's incredible, right? But with the luxation injury, that survival rate plummets to 70%. That hidden damage is without a doubt the single biggest predictor of failure. All right, so once the detective work is done and the full diagnosis is in, we hit the first major fork in our roadmap because the entire game plan changes depending on one simple fact. Are we dealing with a baby tooth or a permanent adult tooth? And this is where our map really comes in handy. You can see the path just splits in two. With a primary or baby tooth, the main goal isn't necessary to save that tooth forever. It's to prevent infection and, most importantly, protect the permanent tooth that's growing right underneath it. But for a permanent tooth, the goal is to save that specific tooth for the rest of the person's life. Two very different goals mean two very different journeys. All right, so let's actually walk through these paths, shall we? We're going to follow the decision tree for both primary and permanent teeth and see exactly how a dentist decides what to do and when. First up, let's follow the path for primary teeth. The logic here is pretty simple and direct. First, the dentist needs to determine if the tooth can even be fixed. If it's just too broken, or it is likely to damage the permanent tooth bud, the safest move is to take it out. If it can be saved, the next steps are about a full history, clinical assessment, and x-rays. For a primary tooth with a complicated crown fracture, a CSC pulpotomy is recommended when the pulp is vital and the tooth is restorable. If the tooth is non-restorable or the pulp is necrotic, Extraction is the safer choice to protect the developing permanent tooth underneath. Okay, now let's switch gears and follow the path for permanent teeth. As you can probably guess, things get a little more involved here because the stakes are so much higher. We're playing the long game now, lifelong preservation. So, on the permanent tooth path, right after checking if it can be fixed, we hit another huge question. Is the root formed? See, an immature tooth in a young person, where the root tip is still wide open, it's like a teenager. It has this incredible blood supply and an amazing ability to heal itself. But a mature tooth with a closed, narrow root tip, its healing ability is not the same. That one factor, root completion, heavily influences what happens next. For a living vital pulp, we're basically looking at two main options, and the star of the show, according to the evidence, is the pulpotomy. It has a high success rate and gets a strong recommendation. The other option, direct pulp capping, or DPC, is where you just put a special material right on the nerve. Its success rate is lower, and it's only recommended conditionally, maybe for very select cases or as a temporary fix. The bottom line? The guidelines are pretty clear. They're pointing right at pulpotomy as preferred treatment. So, what exactly is this pulpotomy procedure? Well, it's actually pretty clever and conservative. The dentist goes in and removes just the very top layer of the pulp tissue that's inflamed or damaged. Then they place a special healing agent, something called calcium silicate cement, that actually encourages the healthy pulp underneath to heal and build its own protective wall. And then comes the most important part. They seal the whole thing up tight to keep any new bacteria out. And you know, if we pull back and look at that whole map again, you'll see something really telling. Every single successful pathway, it doesn't matter if it's for a primary tooth or permanent tooth, they all end up at the exact same final destination, a well-sealed restoration. Seriously, I can't stress this enough. All that brilliant biology and careful work means nothing if bacteria can leak back in. The final filling or crown is every bit as critical as the emergency treatment itself. But hold on, the story isn't over just because the tooth is fixed and patient leaves the dental chair. The initial repair is just the start of the biological road to recovery. And the road needs to be monitored very, very closely. And that's because you know biology is complicated. Things can still pop up later on. A tooth can die silently months after the injury. An immature root might just stop growing. The tooth might start to discolor, which needs to be monitored, or the body could even begin to dissolve the tooth's root, a process called resorption. That's why regular follow-up visits are absolutely essential to catch any of these late-game problems early. You know, when you boil it all down, the whole spirit of these new guidelines really comes to life in this one powerful quote from the report. It says, "Evidence supports the dental pulp tissue can heal after dental trauma. Therefore, clinicians should allow time for healing." This is such a big deal. It signals a real shift away from just reacting to damage and toward actively creating the perfect environment for the body to do what it does best, heal itself. So, all this progress naturally leads us to wonder, what's next, right? As our understanding of how pulp works gets even deeper, what's the next frontier? Well, researchers are already looking into regenerative therapies. Imagine regrowing living pulp tissue inside a dead tooth. They're also developing advanced imaging to diagnose the health of a pulp more accurately than ever. The future is all about working with our own biology, not just trying to replace it. And it's all in the amazing quest to save our natural teeth for a lifetime.